A disturbing new report in the New York Times finds diagnosing the early stages of breast cancer can sometimes be wrong, and in some cases, that can lead to unnecessary surgeries and treatment. So joining us this morning with all the details, our own Dr. Jennifer Ashton. Good to have you here this morning,
Erica.
Because we really need to clear a lot of this up. Now, this is focused specifically on one type of cancer, although it's the most common non-invasive form of breast cancer, correct?
Correct. And when you talk about breast cancer, Erica, it's really like saying you're talking about the weather. There are so many different types of breast cancer. This particular article really dealt with a type known as DCIS, or ductal carcinoma in situ, the most common type of non-invasive breast cancer. It's also referred to as stage 0 breast cancer, diagnosed about 50,000 cases per year. Good news is it's 90% curable, but this article raises concerns that more than 17% of the time it might be misdiagnosed, saying there's a cancer there when in fact there is not.
And part of that problem for the misdiagnosis is that the mass that they're dealing with it's referred to as maybe a few grains of salt.
Correct. So there's three basic reasons that any cancer, especially this one, could be prone to misdiagnosis. And they basically fall into three categories. One is based on imaging. So when you're talking about breast cancer, most people are aware of, you're talking about mammography. It's not a perfect imaging modality, particularly in young women. It can see things there that are not cancer, and it can miss cancers that are there. When you go on and talk about DCIS, we're talking also about mistakes in the biopsy process. So this is when part of the tissue is removed. A pathologist looks at that slide and has to make the call. Is this or is this not cancer? And when you're talking about diagnosing a cancer at an early stage, that is fraught with human error. And finally, even in this case, mistakes with treatment. There is controversy amongst medical oncologists and breast cancer surgeons about how this cancer should be treated, and in some cases, even if it should be treated, because it doesn't always progress to invasive cancer.
So then that's the biggest concern, obviously, with a misdiagnosis, is you may have some procedure done that you didn't need.
Absolutely, and we're talking about here things that are not low risk or low morbidity. We're talking about invasive and potentially disfiguring treatments, surgeries, and also the psychological impact and fear and stress on a woman, which is not insignificant.
So if a woman has been diagnosed then with DCIS, this one form of breast cancer, what should you do?
So important. Number one, get a second opinion, and in some cases, get a third opinion. And when you're talking about a cancer diagnosis, you might want to have that slide reviewed by another pathologist. Do not feel like you need to rush to treatment. You have time to consider these options. And lastly, as we say with so many things, consider the risks versus the benefits versus the options to any proposed treatment.
So good to have you here to flush that all out and make it a little more palatable for the layman. Jen, thanks.